Everyone is asking the wrong question about AI in healthcare. They keep asking, what happens when the AI gets it wrong? That's a fair question, but it's not the dangerous one. The dangerous question is what happens when the AI gets it right 95% of the time. Here's what the research actually shows. When automated systems hit 95% accuracy in the prior authorizations, human reviewers don't get sharper, they go blind. Researchers call it severe vigilance decrement. This is where humans become a mere rubber stamp. Not because they're lazy, because the system taught them to stop thinking. I spent 4 weeks writing a series on AI governance in hub operations, 4 articles. And what started as a question about governance design ended somewhere I didn't expect. It ended with the human. Welcome to the Hub Brief. I'm Ankur Jain, and today I'm walking you through the full arc of that series, not article by article, but as one connected story. Let me start with the pattern healthcare keeps repeating. Three technology waves hit healthcare in the last 2 decades, and we made the same mistake every single time. EHR promised unified clinical data. It turned into a documentation burden that added hours to every physician's workflow. RPA promised efficiency. Only 3% of deployments ever scaled beyond 50 bots. 3%. And now AI promises contextual intelligence, but 69% of payers are deploying it with no governance model at all. And here's the part nobody talks about. The organization being the most cautious are failing just as badly as the ones with no oversight. I call these modes overgate and the missing rail. The overgate is what happens when every decision gets routed through manual review, regardless of risk. Staff is overwhelmed. Turnaround times don't budge. You paid for intelligence and you got a more expensive spreadsheet. The missing rail is the opposite. No escalation triggers, no accountability chain, and it doesn't fail quietly. It fails the first time a regulator opens your file. The fix seemed clear. Stop building gates, build guardrails, calibrate your oversight to risk, not to fear. That was just the framework, but that was only the beginning. The second article uncovered a bigger problem. Every organization I've worked with says they have human in the loop oversight, but almost none of them actually do. Human in the loop is a phrase, it's not a framework. And the gap between the two is where most governance failures live. Eversana showed what a real framework really looks like. They handled 92% of benefit verifications through AI in real time, and they reserve human case managers for the 8% of complex exceptions that actually need judgment. That's a designed handoff. Most organizations are doing the opposite. They're reviewing everything, which means they're effectively reviewing nothing. And here's a number that should keep you up at night. When AI confidence exceeds 90%, human error rates in clinical oversight settings increase by 12-17%. I want you to sit with that for a second. The better the AI performs, the worse the human performs. And this leads us to a deeper problem I mentioned in part 3 of my article. It's the failure mode that rewrote the whole series for me. It's called automation bias. It's not recklessness. It's not laziness. It's not a failure of attention. There is a study from the Lancet published in August of 2025 where researchers tracked gastroenterologists using AI assisted tools. The AI was good, detection rates improved, adoption was high, and they measured what happens when the AI was turned off. Unaided detection rates dropped from 28 to 22%. That's a 20% relative decline. The AI made them better with the tool, and it made them measurably worse without it. But here is what really got me. A separate study found that clinicians overrode their own correct decisions in favor of the machine's recommendations in 6 to 11% of cases. And when machine was wrong, error probability jumped 26%. They knew the answer, They saw a different answer on the screen and they went with the screen. Now, stack that across a hub environment. Nurse case managers processing dozens of cases per shift, PA specialists working off AI generated summaries, and so on. And here's the final twist: training can reduce commission errors. That's when you override your own judgment by 33 to 40%. But omission errors, when the reviewer simply stops looking, training doesn't even touch those. That failure is neurological. It's vigilance fatigue, and no policy document in the world fixes it. So here's an uncomfortable picture. You can design the right guardrail, you can map the handoff perfectly, and the human can still drift. Not because the framework failed, because nobody designed for what happens to the human inside that framework. I want you to stop here for a second. If the AI went down tomorrow, would your people still know how to work those cases the way they used to? Not whether the AI is performing well, whether your people still can. That question is not theoretical because regulators are already asking those. The governance question in specialty pharma used to be internal. It isn't anymore. In January 2026, CMS launched WISeR, deploying AI to screen prior authorization requests across 6 states. When AI recommends denial, a licensed clinician must review and sign off. That review isn't recommended. It isn't best practice. It is required. If your workflow doesn't match that standard, you're running a model CMS has already rejected. Then there is a UnitedHealth lawsuit. Their own contract said coverage decisions would be based on individual patient data. Their AI tool instead was applying population level statistics. The gap between what the documentation described and what the workflow actually did, that is exactly where the court found the liability. A federal judge ordered production of governance documentation, including 9 years of custodial data. These regulations are voluntary today, but it will be mandatory by 2027. Here's a singular shift I want you to take from this series. We've been measuring AI governance by the wrong metric. We keep asking, is the AI accurate? Are the error rates acceptable? Instead, the question that matters is whether the human reviewing AI's work still knows how to think, not just today, but 6 months from now, after AI has been right 1,000 times in a row. A handoff that ignores skill atrophy becomes a rubber stamp, and governance that looked right on paper slowly hollows out from the inside. The organization that gets this right doesn't have less AI, they have better designed human engagement. The AI runs fast, the human review is active, and the governance framework actually monitors human judgment over time. The guardrail doesn't slow you down. It's the only thing that keeps you on the road. This is the Hub Brief. I'm Ankur Jain. I'll see you next week.